So there's this one topic that and we all do this, okay? This is why I've been trying to bridge the gap and play devil's advocate between good doctors and patients, and why I've tried to call out bad doctors, and I've also called out good doctors. I leave good referrals. I stopped doing the fucking thing because I would have to call out a lot of ignorant doctors a few months ago just so that I could take a break from complaining about these motherfuckers. However, with that said, the reason there is a gap in finding the right medications for your patients is because, based on data collected of good experience amongst patients, you prescribe those same medications. And let's just use gabapentin as an example, okay? Because gabapentin harmed me in real ways. I stopped being able to work in the office when I was on gabapentin. That's when I finally told my mom I couldn't renew my license anymore. I just couldn't handle it anymore, because not only did it turn me into a complete zombie, I couldn't do math anymore. I was confusing numbers. So gabapentin is very great for patients with certain conditions who don't have other conditions that create neurological impairments. So whether you want to acknowledge that HEDS, HSD, hypermobile syndrome, I don't know, the hypermobile disorder, whatever it's called. Anyways, those affect neurological conditioning, okay? That goes for migraines, that goes for trying to think, anything that causes inflammation, really. Anything that causes inflammation, okay? Gabapentin works on the nervous system. If you have a person with an elevated inflammatory response, MCAS, for example, or extreme allergies, for example, histamine intolerance, for example, cortisol intolerance, for example, all of those things, when you give them gabapentin, they're at a higher risk of developing memory problems. Just based on the people that I've talked to that have been on this medication. Mind you, some have been on it for 20 years and have not experienced these neurological problems. Why? Because for them, that was the right medication. The moment you started seeing personality and neurological differences in your patient from taking that are not good, such as memory loss or function, then you need to consider putting them on a different medication, not labeling them as substance abusers for not wanting to take gabapentin. Okay? That's just my thing. As much as you want to believe that a medication works for a patient, and you believe it so wholeheartedly because you chose that medication and you're like, hell yes, this is the right one, it's not going to cause addiction, blah, 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 blah. You also need to believe the patient that is telling you that they're being harmed. Because those patients, those sensitive patients, as a person who has had some of the most rarest reactions to medications, the ones they don't even tell you about in the pharmacy because they're so rare, as someone who has had those reactions, once you have had those reactions to 2 or 3 medications, it should automatically be put on your chart that all options need to be exhausted before medication is provided. Not just pain medication. You guys took it to that extreme with pain medication because you created substance abusers where there wasn't substance abusers. They were just struggling with the right pain management because you weren't addressing all the other issues. That inflammation from MCAS causing all kinds of issues. Those migraines starting to cause serious neurological conditions because you're suppressing the nervous system instead of trying to find the trigger for the migraines and remove the trigger. Oh, but people can't leave their employment. People can't do this. I get that. The reason people can't do that is because scientists haven't written paperwork that says, hey, A person who suffers with migraines, who stays working in the employment that is triggering the migraines, could cause further neurological damage. If you don't write a paper about those consequences, disability and all other forms of assistance are taken from that person, because you're not saying how it affects their life and how it can leave them permanently disabled if they remain in that employment. If you did this, people's school loans wouldn't be crippling them, and they would be more likely to go back to school, to learn a new profession, knowing, hey, you know what? This one was hard on my health, so now I need to switch. And it's not just the people hustling and putting their health aside to be able to make it that go back to school. It would be everybody. All disabled people would make an effort. And I know this. I know that a lot of people stop making an effort because any effort you make means you will lose medical insurance. It means you will lose disability benefits. You guys don't even realize that you created the problems with our disability system. You've created the gaps between our social security systems with this bullshit. Because instead of providing the care people need when they are unwell so they can get better and return to their work, or providing the care that they need so that they can switch professions to something that is less harming for their bodies, you're creating the disabled people that you're fucking complaining about. You are literally creating the disabled people you're complaining about. Because a lot of the mental health disorders that I've been tagged with were not because of mental health problems. They were because of medical conditions and the people around me not knowing enough about those medical conditions. Because one, there isn't classes that teach caregivers about medical conditions as much as you do diabetes classes. If a person is diagnosed with MCAS, there should be a class to teach their family about what they can possibly see and what to look for if the disease progresses. I know with memory care, a lot of those things, once the person is far gone, that's when they start doing the classes. But I believe that the moment the person gets diagnosed, or the moment that there's an inkling that that person may be developing those conditions, instead of encouraging family members to trigger their family members, you should be teaching them what to look out for to allow a natural disease progression instead of forcing a disease progression by ignoring the disease itself. And then if you do that, you might learn how to accommodate the disease so that people can learn to live long term with debilitating diseases like migraines. Because there is ways around it. I have found millions of different ways to be able to drive with some of the migraines that I have. Some of them are not safe to drive with at all. I have to pull over the moment I feel it coming on, and I have to go to sleep wherever it is that it comes on. Because if I let it get to the vomiting point, I'm already to the point where I need to be hospitalized. Little vomit in the mouth, that's okay. But once I'm to that gagging point where you can't stop and your body is just contracting when it has nothing else to vomit, that leads to hospitalization due to dehydration, which creates a cycle of migraine relapse. So that's just one example of the many ways that certain diseases can be accommodated, and the different ways where technology has assisted people with conditions to be able to move forward. However, if you're not willing to safely allow people to live with these conditions without constantly triggering them to see if they actually need what they need to accommodate their employment, you're waiting until they're disabled to help them. Because even now, if I wasn't so scared of hitting somebody, maybe, since driving is something I like to do, maybe I'd do long distance deliveries. Maybe, if I wasn't so scared of what happens to my brain when it shuts down. Because I don't have a vehicle that drives itself. So I don't have the luxury to not live with the fear of possibly crashing, which does make migraines worse to live with that fear while you're driving. I know this because this weekend I have been trying to push myself this week, trying to push myself to see what my limitations are. And there's way too many limitations to somebody who has daily migraines for them to be in long distance driving or even driving on a daily basis. But the forcing us into doing that to not lose our employment is what makes us sicker long-term and long run. Because even though I've had dysautonomia symptoms since I was young, they weren't consistent. And now they're consistent because my body has not gotten a break. So my nervous system cannot relax. So it's taking over and saying, you know what, bitch? You ain't doing what's right for me, so I'm going to do what's right for me. And if I have to fucking make you pass out, that's what I'm going to do. So just keep that in mind when you're developing these disability curriculums, these back to work curriculums, blah, 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 blah. Because so far, what's been offered to me is not congruent to health. It's angering and frustrating, and I get it. I've said it before, and maybe I haven't posted all those videos. However, a person who is recovering from drug addiction and a person who is recovering from medical problems may have similar frustrations. However, they will never be able to see eye to eye. And there will always be fights around accountability, expecting the person with medical conditions to be able to physically keep up with the person who has solely drug addiction. Although I don't believe there's any drug addicts that just have solely drug addiction. But when that's the main thing that they need to get out of, it's really, really difficult to get that out of their head without them taking it out on everybody around them. People with chronic illness, most of us stay to ourselves because we don't want to take it out on other people. Our rehabilitation needs to be more community-based for us to be out in the world instead of isolating ourselves. But because of the way the world treats us, we isolate ourselves. Because of the programs that are available, we are often labeled with things that we don't have so that we can qualify for programs, and that's not okay. Because in that long run, it affects us to be labeled as drug addicts when we're not. It affects us to be labeled with mental health conditions that we do not have. It really affects our ability to be out in the world without the accommodations we need. But because we don't need those accommodations every single day, we can't even qualify for those accommodations, even though that will keep us, quote unquote, productive longer. You keep claiming you want more productive members of society, but then you don't want to accommodate their needs. Okay. Sensory meltdowns are very real, not just for autistic people. They're very real for people with PTSD. They're very real for people with CPTSD. And they're very real for people who suffer migraines and other neurological conditions like Parkinson's, Alzheimer's, dementia. And I learned this by working with these kind of conditions. MS. All of these conditions tell us something about the brain that tell us, you know what, maybe we are overloading our senses on a daily basis. And maybe the detox we need is a sensory detox. Maybe there needs to be a disability criteria or curriculum so that we can have programs that help us go back into the world. Because honestly, we're just making the world louder and louder. And for us, it's very difficult to relocate further and further away from cities because we need medical care. Because we need medical care, we're also constantly abused and mistreated by these programs that we have to be part of to be able to get the care that we need. So we're constantly being called names, even accused of things that we didn't do so that they can get away with treating us how they do, and so that no one will listen to us the moment that we complain. That's what they do to us in these programs. And that is what you guys continue to allow. You continue to allow it. So really think about these things and really, whatever area in your life that you work in, see how you can accommodate others. What is the theory? The blue curb theory. The blue curb, it helps us all. And the fact that that we don't want to acknowledge that these sensory accommodations can actually prevent early long-term illnesses, extreme illnesses, extreme neurological conditions. Even seizures improve when people have less stress. So just keep that in mind. Because you shouldn't need 3 jobs to be able to pay rent. You shouldn't need 3 jobs to be able to pay your medical bills. 1 job should be able to cover your rent, your food, and your medical. And if they're not going to give us living wages, then they can't keep cutting our medical or determining who can have it and who can't based on productiveness. Because you guys are the ones destroying our ability to be productive. And it is evident by not offering the accommodations before long-term problems arise or conditions arise. The staples in the back of my head in February were not necessary. We determined back in September that I needed IHSS. It's only being denied to me because I live in my car. It's that simple. You want me to be out in the world putting my life in danger and then blaming me for not being able to work when these injuries are still occurring because I don't have medical care. This needs to change. This needs to change. If we really want a better society, if we really want America to actually be great, the United States of America to actually be great, not the figment of the illusion they've created of greatness, then we need to think about the beings that we believe are lesser. Because if the lesser beings in our society are not well taken care of, we are just creating a hierarchical system like the kings and the queens that let their people starve. Not because they were lazy, but because they got sick and tired. The majority of the crime is because of that in the United States, because people are sick, tired, and desperate. So really keep that in mind. I love you and have a beautiful day.